Good morning, everyone. Today I'm making this video because one of my women, for me, almost all women, I don't really consider them as patients. They're my clients. I have a skill and they have a need, and I'm here to help them. So one of the women whom I know for a very long time was asking me, Madam, why don't you tell us about hysterectomy and life after hysterectomy? And I thought that's a very relevant point that she asked for. Uh, First, you need to understand that removal of the uterus mm, is should be done as a last resort. The thing is, if you have a problem that cannot be controlled by medications, or the medications are causing you so many side effects that your quality of life is very poor, then only, or if there is a risk of going on for a cancer in the long term. So, those should be the only indications for which the uterus is removed. Every organ in the body is designed to do a particular function. So, removal of that means we are losing something in ourselves. But when the organ is diseased, when it is causing harm to the rest of the body, that is the reason after women complete their childbirth, because the uterus is basically designed to give rise to a baby, some women might opt for hysterectomy. The most common causes are having abnormal uterine bleeding. And if the abnormal uterine bleeding is non responsive to medications, you're not comfortable with conservative managements like having a hormone releasing loop inside your uterus, which works in almost 75% of people, and there is you're not just in the perimenopausal period. That means within 1 to 2 years, if you're going to go into menopause, then I think you shouldn't be having a hysterectomy. But otherwise, hysterectomy is a one time good solution for the other women. So if the cause is abnormal uterine bleeding, having a hysterectomy will definitely solve that problem. But we need to remember that the ovaries are just beside the uterus, and part of the blood flow to the ovaries comes from also these blood vessels. So if the ovary has its own blood supply, it also gets a supplementary blood supply from the vessels near the uterus. So if the ovary is able to withstand the lack of this blood supply by a compensatory increase in its own blood supply, then most of the time it does not cause any problem. But if that does not happen, or during the surgery there is some problem, and sometimes even an ovary is removed, then there will be premature failure of the ovary. The hormones that are coming from the ovary are what are necessary to keep the woman's body healthy. So it is essential for the way we think, our moods, our temperature regulation, the femininity that we have. It is necessary for the skin, it is necessary for the vision, it is necessary to prevent women from having high blood pressure, having osteoporosis, having coronary artery disease, and especially the urogenital area, maintaining the health of the skin near the vagina, preventing recurrent urinary tract infections, preventing a vaginal atrophy and a constant burning sensation, and recurrent vaginal infections, preventing women from going ahead with their sex lives. So, all these will occur with decreasing estrogen, and they might be the consequences of a hysterectomy also. So, women, if after a hysterectomy, they're having hot flushes, they're having cold sweats, they're having easy arousability and inability to sleep now, these are the women who need to have an evaluation with the doctor and get your hormone replacement therapy started, because these hormones are supposed to work in the woman's body till almost 49 to 52 years. And if this hormone deficiency is there earlier, the woman's body ages so much faster. And if the hysterectomy was done for a severe condition like endometriosis, which is a hormone dependent condition. The problem with hormone replacement therapy will be that endometriosis can flare up. So we need to tweak your hormone replacement therapy in such a way that your health is maintained, and at the same time you don't have the sort of problems of recurrence of your previous disease process. And sometimes hysterectomy is done for pelvic organ prolapse. That means all the uterus and the vagina, cervix, they sink down. That is because the ligamental support is very weak. So if that is the reason for a hysterectomy, sometimes after removal of the uterus also, those ligaments and all are so weak that you can have a vault prolapse. So having good pelvic floor exercises and a muscle tone is very, very important. Recovery after a hysterectomy, especially a laparoscopic or vaginal, is within 3 days, but it takes almost 3 months for those ligaments to become strong. So you need to avoid straining since then. After the pain subsides, after 1.5 to 2 months, when you have a checkup internally done and the vault is well healed, can go back to your normal sexual life. Only thing is, listen to your body, don't push it to the extreme, and do as much as possible and get back to as much life as possible. I hope this was useful for you all. Do send in comments, whatever you would like to, and do ask us what other topics you would like to cover, and definitely we will be able to do that. Thank you. Have a good day.